COVID-19 continues to cause significant burden to many communities worldwide, including the United States. The Delta variant is causing a surge of cases due to its increased transmissibility, resulting in an uptick of cases with corresponding increase in hospitalization. My name is Dr. Raymund Razonable, Professor of Medicine at the Mayo Clinic in Rochester, Minnesota, and I am going to present to you our study, Clinical Prioritization of Anti-Spike Monoclonal Antibody Therapy in patients with mild to moderate COVID-19. The article will appear in the January 2022 issue of the Mayo Clinic Proceedings. Efforts to curtail this surge includes a layered approach. First will be vaccination, encouraging vaccination to as many people as possible. Second are the other public health measures to mitigate the risks, such as masking, social distancing, as well as frequent hand washing. And the third one is early testing of symptomatic patients so that treatment is given early with the use of anti-spike monoclonal antibodies. What are anti-spike monoclonal antibodies? These are laboratory-made proteins that mimic the human immune system and provide early and immediate protection against COVID disease progression. These antibodies have proven to be very effective in reducing the risk of severe disease from COVID, resulting in reduced rate of hospitalization. Accordingly, the demand for these products have increased remarkably in the United States and worldwide. The increase in the demand is the result of three factors. Number one, the expansion of the FDA EUA eligibility criteria for treatment with anti-spike monoclonal antibodies to include as many patients with high-risk characteristics and comorbidities, including age, heart disease, diabetes, lung disease, immunosuppression, among many others. The second is the continued surge of the Delta variant in the community, resulting in a widespread community transmission. And the third one is the expansion of the criteria to now include post-exposure prophylaxis to patients even without the development of symptoms. The increase in the demand for monoclonal antibody treatments raises the concern for scarcity. What do you mean by that? Scarcity means that the supply of the monoclonal antibody product or the capacity to infuse them in infusion centers does not meet the increasing demand. If this is the case, how do we then select and prioritize patients who need these life-saving products during periods of scarcity? At the Mayo Clinic, we leveraged the electronic health system to develop two scores. Number one is MASS, MASS, the Monoclonal Antibody Screening Score, which captures those that are at highest risk for COVID-19 complications. The criteria for this score includes those that were released in November 2020 FDA EUA guidance. The second score we termed CAST, the COVID-19 Antibody Screening Tool, which captures all the characteristics included in the May 2021 expanded criteria, including characteristics that we consider relatively low risk. In this perspective article published at the Mayo Clinic Proceedings, Drs. Byerly, Ganesh, and I discussed our perspectives in addressing anti-spike monoclonal antibody allocation during periods of scarcity. We used the data that we have generated since the start of the monoclonal antibody treatment program at Mayo in November 2020. Specifically, we demonstrate that MASS and CAST can be used effectively as complementary tools to determine clinical priority and guide the allocation of monoclonal antibodies to patients at highest risk. The use of these scores identify the subgroups of eligible patients who are at highest risk for hospitalization and therefore would benefit most from prioritization for monoclonal antibody treatment. We observed that CAST and MASS scores were directly correlated with the risk of severe disease and the need for hospitalization. This means that the higher is the CAST and the MASS score, the higher is the risk of hospitalization in patients with COVID-19. Those with the highest scores should therefore be targeted for early treatment with monoclonal antibody therapy. We further observed that CAST is a more sensitive marker, but MAS is more specific when the outcome of interest is severe disease in hospitalization. We therefore encourage the medical community to use these scores, the MAS and the CAS scores, to identify and stratify your patients who would benefit the most from treatment with monoclonal antibody therapy. The details of these scores are published in this issue of the Mayo Clinic Proceedings. Thank you for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.